Good afternoon. My name is Dr. Seun.Ross. I am the Executive Director of Health Equity at Independence Blue Cross. I am pleased to be with this esteemed panel this afternoon discussing Black maternal health. As we know that the statistics are abysmal. Black mothers die at a rate of 3 to 4 times their white counterparts. And this panel is going to help us not only understand why, but what we can do to sort of change the we're going in the wrong direction. And hopefully this panel will give us ideas and tips on how we can write the course. So I am going to ask a question, and please, when I ask you the question for the first time, please introduce yourself um, to the group. So my first question is to Renee. Um, Dr. Wynn, how can nurse practitioners play a pivotal role in advocating for comprehensive prenatal care that specifically addresses the unique needs and challenges faced by Black mothers?
Great question. My name is Dr. Renee Wynn. I am currently the clinical site director and women's health nurse practitioner at a maternal support program in Philadelphia called Care. I also do some clinical adjunct at Thomas Jefferson University for their women's health MP program. So, to answer your question, Dr. Ross, when I think about the role of a nurse practitioner in the maternal and obstetrical landscape, I realize that we not only provide prenatal care, but nurse practitioners are in a space where we can really provide comprehensive education, support, resources to Black moms throughout their prenatal journey. And this is what it looks like in clinical aspect is like discussing things like the importance of adherence to your prenatal care, to medical recommendations, to medical interventions, also the importance of proper nutrition and exercise and managing stress, and giving some stress management techniques that are tailored to the specific needs of Black moms and birthing people. Nurse practitioners can also empower mothers to take an active role in their prenatal care and decision making process. And this involves like fostering a collaborative and a patient centered approach that respects the autonomy and the agency of Black moms, empowering them with knowledge and resources. We're able to help them make informed decisions so that they can confidently navigate the complexities of pregnancy as they go through their journey.
Thank you, Dr. Wynn. Dr. Taylor, Dr. Wynn discussed being innovative in approaching how to care for Black mothers. You, as the creator of the Delaware County Health Department, you've undoubtedly witnessed various challenges in addressing disparities in Black maternal health. What innovative strategies or programs have you implemented to specifically target and improve outcomes for Black mothers and babies in your community?
Thank you, Dr. Ross. Um, my name is Monica Taylor. I'm the chair of Delaware County Council. And excuse me, in that role, I help to coordinate and oversee and be a liaison to all of our social services, including our human services and our brand new health department. Although I say brand new, we were able to create it about 2 years ago. And what we've really been working on is looking at those disparities that exist in Delaware County, especially when you look at what's happening with our healthcare system in terms of Chester Crozier, closing of some of our maternity supports within the county, and how that is really impacting our communities of color. And this is an issue that's near and dear to my heart as a mother of three daughters, and working in this space and really understanding that we don't have services available, and that is what's driving some of the disparities that exist in Delaware County. And so, with our health department, we actually created a maternity, parental, and child health working group to work through some of the issues and look at the data. And with the health department, for the first time, we were able to do a community health assessment and really get data to back up and support what we're trying to do and what we're focusing on. And one of those items is working with Senator Casey's office. We were able to get a grant for doula services and to train more doulas and to work with our community-based programs to do so and to train doulas in our community. We are also looking at putting forward a healthy baby program. a Hello Baby program where we actually connect with every single mom that is delivering a baby that is a Delaware County resident and get them connected to services. And so it's more of an opt-out model where everyone is put into the program and we just send you all the information and try to get you connected. If you don't want it, then that's fine. But we want to make sure that everyone has access and has the ability to be able to get into those services. And so those are some of the things we're really trying to do with our new health department, even in its really short term here in Delaware County.
So thank you, Dr. Taylor. I'll ask this question of Michele and then come to you, Caron. Dr. Taylor mentioned that, we have the challenge of access in certain areas. And then not only do we have a challenge of accessing care because of the closure of hospitals and maternity birthing units in its totality, we also have the challenge of not having sort of cultural congruence or racial congruence. So as a certified midwife, how do you envision culturally sensitive maternal care positively impacting Black maternal health outcomes, and what strategies can midwives employ to integrate cultural sensitivity into their practice?
Thank you so much. That was a great question. And my name is Michele Lamar Suggs. I am a certified nurse midwife at Pennsylvania Hospital and founder of Royal Generation Inc., which is a nonprofit that was started to help to improve the social determinants of health for women. And I also sit on the Philadelphia Maternal Mortality Review Committee, where we review all of the deaths of women in the city of Philadelphia. And so one thing I always say is that before we can talk about cultural competence, we have to be able to talk about and acknowledge the need for cultural humility. And what that does is says, we know what we know and we don't know what we don't know. And we're willing to humble ourselves to learn the things that we need to know to provide impactful supportive care for women. And so that allows us to show a respect for all the diversity that our family and families and women bring. And so I think sometimes where we kind of miss it is that we automatically assume that culture implies race or ethnicity, but culture is really understanding the patterns, the values, the shared ideas, the practices that really cause us to be able to meet women where they are culturally. And so we have to be okay. One thing I always say is be okay with knowing what you don't know, and what you know, fine, take credit for. But learning from, while we feel that patients are always, because we come from a paternalistic point of healthcare where we feel like, okay, you listen to us, you listen to me, we have the answers. But how are we saying, hey, that's something that I'm not familiar with. Tell me a little bit more about that so I can be able to support you the way that you need to be supported. And so understanding, having understanding of ourselves, understanding of our others, and legitimizing the differences that are there, and really working to build a bridge, because a lot of times it becomes a point of division, but really we need to build a bridge with our families. And so what that ultimately looks like is, like someone said, having patient-centered care that's not provider focused. We've become, so provider focused that we minimize and we forget that we're here to service our patients and give the best equitable care that's surrounded around them, not surrounded around us. And being okay with providing individualized care. Everyone who comes to us is coming from a different walk of life with different types of needs, physiologically and psychosocially, and being okay to not treat each person cookie cutter like sometimes in healthcare it tends to be, but sitting down and taking the time to individualize specific care. Understandings, I can go on and on, but understanding family differences, the importance of family, the importance of community, religious dynamics, and what that plays, and being flexible. I think we have just downright become inflexible, because if we're not comfortable with it as the provider or as the system that's providing the service, it causes us to operate in a place of rigidity and inflexibility, because it shows our loss of control, when really we should be empowering women to have control.
Right. Absolutely. That's a good point. Thank you so much, Michele. I think that the folks that will well, at least what research has shown, right, is that community health workers offer us the best opportunity to achieve great health outcomes. And the for this space, the type of the community health worker is the doula. So Caron, as the registered nurse and the doula, what are some of the key factors contributing to disparities in Black maternal health outcomes, and how can doulas effectively address those issues within the healthcare system?
Yeah, that's a great question. Thank you, Dr. Ross. So my name's Caron Drummond. I am actually a British trained midwife. Came here a few years ago, a lot of years ago, and decided to work as a nurse. So I have been a labor and delivery nurse. I worked across the continuum of care for all of maternal child health, and I doula in every community that I work in and among my community. So the doula space is such a unique space, right? We take non-clinical, non-professional people who are embedded in the community, and we train them to care for their own. And that is such a beautiful concept. In my opinion, the doula causes an open door, right? They are a voice, they are an ally, they wrap their arms around the family and not just the pregnant person, but the whole family, and they connect with them early in pregnancy or even before pregnancy, so that they can walk alongside them along the continuum of pregnancy. And if they see something going awry, they're going to see it maybe before the pregnant person does, and be able to communicate that to the family and to help the mother communicate that to her physician. So she's a voice, she's an advocate. She provides emotional and physical and spiritual and all the care that she needs throughout the continuum of care. And it doesn't stop when delivery happens, right? We move into the postpartum period. All of the research is showing us that maternal mental health is huge after that third, fourth month of pregnancy. And the doula or the community health worker can still walk alongside that family in those times to be able to help them access the care that they need. The other thing that's really important to me working as a doula is it's not just about pregnancy and everything around the pregnancy, but it's around the social determinants of health. Like, if a mom doesn't have the money to eat, if she can't keep her lights on, she's not going to feed that baby that she's carrying. She's going to feed the children that she can see. So how do we give her everything that she needs to care for her family so that she can take care of herself and take care of that baby that she's carrying? It's just a whole village, right? We're taking care of everybody all together to be able for everybody to have a better outcome. Because when one mother dies, it creates such a ripple effect across the community, across everybody that she touches. So that's the reason why we want to take care. Doulas are such a great asset to their communities. And your first question about the contributing to the disparities, I think lack of access to care, lack of education, lack of information sharing, because it's not always just about the education, but if the information is not shared with the family or with the pregnant person, how can they access that? So sometimes it's education, sometimes it's information sharing, and not providing all of the options available. So when the provider decides I'm going to offer these options and only these options, that's just not equitable. Tell me everything. Let me pick from the table that's available to me. And that's what I think doulas and getting rid of some of the disparities is going to do. I hope that answers your question.
I love that. I love that. Picking the option that works for you. I'm sorry, go ahead.
I wanted to just kind of piggyback off of that because that was very powerful and so on point. What I've learned as working as a nurse practitioner in this maternal health space, that effective prenatal care, especially for communities of colors, birthing people of color, it does require a multidisciplinary approach to that type of care, and that approach needs to involve the midwife, the OB, the social service, the social workers, the community health workers, the community agencies, all types of different layers of health professionals to really provide the needs, the diverse needs and the challenges that our Black moms and birthing people are facing. By fostering partnerships and communication amongst various stakeholders is where we can really ensure a holistic and coordinated care that will meet the needs of our Black moms and birthing people. So I totally agree with you, Caron, on that.
And I think it's really important I think when we encounter our clients or our patients, one thing I like to say to them is, tell me your story, because everybody comes with a story, and we want to give them lots of information, but we don't want to learn their story. And the important part of that too is saying, who's important to be here for you. And so we do a lot of elimination of, okay, you can only have one or two visitors, or you can only, all right, you want your partner, or you want, but what about, sometimes it may be the pastor, sometimes it may be a best friend, sometimes it may be, someone else within that they see as community or village. So really asking who and what services and people are important, and incorporating them as best as possible. And we've become, since COVID, we've become creative with technology. We have FaceTime. We can get people from all over the world to be a part, if that's what it takes to support the women that we're supporting, to make them feel comfortable.
Yeah, I think it is so true. What you have said, Dr. Wynn has said, Caron has said. Dr. Taylor, given the complex interplay of socioeconomic factors, healthcare access, systemic biases, contributing to disparities in Black maternal health, what collaborative efforts have you initiated within community organizations, healthcare providers, and policymakers to address these issues in its totality, like comprehensively? And how do you ensure that those efforts are sustainable and inclusive of the diverse needs within the Black community? I mean, Caron said it great, like, give me options so that I can choose.
Yes, I mean, this is a great question. For me and for us as an organization and a county government, it's really about the health department and us being that chief health strategist, right? It's our job to pull everyone together and make sure that everyone is at the table, whether that's our hospital systems that are operating in our county, our nonprofits who are providing service in the space, our birthing centers, the midwifery support, state and federal elected officials. It's about bringing everyone in and also getting the data and being able to do all of those pieces to pull together and move forward as one unit as to how we're going to address these issues, right? And it's not, it's trying to figure out how, I think, Dr. Ross or maybe said this earlier about how do we create that safe space, and how do we create the place where our birthing people and our women they feel supported and they feel empowered through this process, right? And how do we do that? And it's really about bringing in all of those options, because unless we have everyone at the table, we're not going to come up with a solution that actually meets the mark and meets the need.
Perfect.
And one thing I like to say too
Yeah,
is, not only, and I
Go
think
ahead.
if we bring everyone to the table, we often, in a lot of these spaces, have eliminated the most important people from the table. So we're making policies surrounding women and families, but we have excluded them from the table of decision making. So even bringing them as partners to the table at healthcare institutions, in communities, in policy, to hear their voice, because this is their lived experience. And we have to allow them the platform to have their voice elevated.
Thanks, Michele. I think that the midwives are really the first. First of all, midwives have been around for hundreds of years, and unfortunately, were they the system tried to sort of push them out. Thankfully, the midwives have stuck around. You guys are resilient. And I think that resiliency shows in the outcomes that you have when you do take care of patients. So I'll ask you, Michele, what are some effective approaches midwives can take to empower Black mothers throughout the entire process, prenatal, birthing, and postpartum phases, so that it fosters a sense of autonomy and agency in their healthcare decisions?
And you said it exactly right. And I think it starts, the key here is cultural safety, providing safe environments for women. And, the hallmarks of midwifery start with respect. It starts with communication. It starts with understanding. And so getting back to the hallmarks of why we started and not really getting caught up in the systems of, we don't have enough time, seeing each person as being the same as cookie cutter, but really taking the time to communicate. Part of communication is really listening, because you learn so much more by listening as opposed to talking. Empowering patients to really speak up and say, what's important to them, what makes them feel safe, what makes them feel not safe, and elevating the power of their voice. Because, in so many of our disenfranchised communities, we have been disempowered by having a muzzle placed on our mouths that what we say is not important. But letting them know from the gate, I want to hear from you. Like, how was your experience when you went to this location? Or how was your experience, with this situation? How can I make that better for you? And really building trusting relationships that is really going to elevate and magnify their care, and making them feel like not making them feel, giving them the autonomy to choose. I always say, as we give informed consent, you have the right to choose what's best for you. We're giving you information to decide. You are making decisions, and not belittling them for decisions that may not align with what we think is right, because it's not about what's best for us. It's about what's best for them. So becoming real partners in care and letting them know that you truly care. I say this is my theme tagline for my life. People don't care how much you know until they know how much you care. We have to get back to showing people why we care and why we're in the businesses that we're in. We are in literally the people business.
I'd like to tag on to that trusted partnership, if I might. That's such a beautiful thing. I think doulas and midwives and the whole continuum of care, it's all about trusted partnerships. Mm-hmm. And what a doula can bring to the table is they can talk to the family about what they want that to look like outside of the institution, right? We're in the community, we're at a coffee shop, we're getting lunch, we're at your house. What do you want it to look like? Let's talk about it before we get there, so that we have a plan. It may not go the way that we want it to, but at least we have an idea, so that when the mom doesn't feel like she maybe has a voice, the doula can say, hey, remember we talked about that at your kitchen table? Remember you wanted to explore that a little bit? How about you talk to your midwife about that? How about you talk to your doctor about it? And that trusted partnership is huge, and it helps her to advocate for herself. So I really like trusted partnership.
And I think like what you're saying is, one thing that I try to adapt is that when you understand that what you're doing is a calling and that you're called to people's lives, you realize that it doesn't stop at 9 to 5 or when your doors close. So one thing that I do, sometimes my colleagues think I'm crazy. Here's my cell phone number. Call me. If you get to the hospital and you have questions or something's going on and you don't feel safe, you can always call me or reach out, or call me if you're not having a hard time connecting with this appointment, or call me if you find yourself in a tough, stressful situation and you just need to talk. I feel like we need to extend people feel so overextended that they do little extension of what's really important. And that's your heart, to show people that, hey, I'm here for you.
I think that midwives have done such a wonderful job of doing that. And to the point that patients, I used to be in my former life a hospital administrator. And during the sort of the contention between OBs and midwives, it was the patients that actually said, I want a midwife. And the hospital systems had to comply and allow midwives to continue to practice in their systems. And this was in the DC, Maryland, Virginia area. So for Caron, for doulas, I think doulas are right now going through that a little bit in trying to assure the health system that they are there to support the patient and support the physician, because honestly, all we all want, right, is great, or the midwife, all we want is great health outcomes. So Caron, how do you think that doulas can collaborate with healthcare providers and community organizations to implement that holistic support system so that we are prioritizing the physical, emotional, and cultural well-being of all of our Black mothers during pregnancy.
I think it comes down to trust, right? I think that we need to build trust amongst all of the people concerned. So, so I think some of the things that some of the doula organizations can do, they can partner with the hospital. So I would like to come in and go through a little bit of your hospital orientation so that I know what to expect. I know when this bell goes off, what it means. I know when this bell goes off, what it means, so that when I'm walking in and I'm supporting my person, I'm not a liability to you or what you're doing. I think that's probably where there is a little bit of a disconnect. I think the hospital sometimes sees the doulas as a liability. So the only way you break that down is to build community, open the doors, talk about talk about the elephant in the room. Let's just address them, and let's all agree that we're at the table for our birthing families. And I think when we do that, when we build trust, when I go in and I'm with my family and I get introduced to my nurse, I'm going to tell her, I am not here to do what you do. I am here. I'm going to rub her back. I'm going to get her ice chips if you tell me I can. I'm going to walk her in the halls when you cannot, because you can only be in here a couple of times an hour. I can be here the whole time. I can help change your position. I can do all of the things. I can be an extension of your hands so that she has the best outcome possible. And that's my goal. That's my goal as a doula. I've been the nurse. I've been the midwife, and I choose the doula role. I do. I choose that. I do,
that.
because I don't have to worry about, looking at strips, doing the documentation. I get to be.
Charting.
I don't, none of that.
Yeah.
Been there, done that. But I just get to be with her. I just get to be with them. And that's what I want. That's what I choose. So, yeah.
I love that. So Caron, you talked a lot about getting acclimated, right? Getting acclimated to the system, to the hospital. And when Independence decided to figure out, right, figure out how we were going to cover doula services for our members, we found Kayaba and Dr. Wynn. Because you work for Kayaba, I think it's the partnership between us as payers and with Kayaba. How do you leverage the expertise that the partnership that we have and the fact that Kayaba even exists to bridge the gap in access to quality health services for Black mothers, especially in those underserved communities?
That's a great question. So, in this position as a community supportive nurse practitioner, it's different from being the primary clinician and like the regular traditional OBGYN. So, being in KIABA, I have been able, the most impactful thing that I have discovered that I've been able to do in this space is to really like prioritizing building trust in relationships and rapport that in other clinical practices when I was working at Penn and at Jefferson, I really didn't have the time to really build lasting relationships and forming relationships. And in communities of color, that is very important because there we come in with a level of distrust into the medical system. So having this position, I'm able to like bridge that gap in access to quality care by like providing and building trust in relationships and rapport with our Black moms by acknowledging our cultural backgrounds and the differences that we have, respecting their beliefs and preferences, like Michele said. And by fostering like culturally competent communication, care, and understanding has been very, very, very impactful in what we're doing. I will have patients come to me and say, "Oh, I'll say, are you taking your iron pills?" Just hypothetically, are you taking your iron pills every day? No, but I told them that I am. So tell me why. But the fact that they tell me that they're not and that they're telling their providers that they are allows me to kind of fill that gap and like re-educate and really go through the importance of it and why they're telling you to do it. So that has been very impactful in some of the work that I've done at Kayaba Care. And just ensuring that mothers feel respected. Like I've been able to kind of ensure that they understand what we're asking them to do in our clinical settings in our traditional OBGYN practices. And they're able to really understand and make an informed decision on their own, right? And even if they still have questions, I'll say, well, when you go back, ask this question. When are you going to recheck my hemoglobin? And then if it's this slow, what happens? And what does that mean? What's the implications? Like I've been able to empower them with questions that they can take back to their OP providers again, so that they can be informed and like having like a partnership based approach to care has been what I've been able to find most rewarding in the work that I'm doing at KABA.
Thank you so much. So as we conclude this panel, I'm going to ask all of you to answer this question. What commitments or next steps do each of you envision in your respective roles to contribute to the goal of achieving equitable maternal health outcomes for Black women? And Michele, let's start with you. Michele, you're on mute.
Thank you. I'm sorry. My
No worries.
ongoing commitment has been to work diligently to diversify our profession. Cultural congruency and concordance between healthcare providers, research has shown to drastically improve outcomes. We know that 14% of birthing people in America, or 14% of Americans are Black or identify as Black, and only 5% of midwives and only about 11% of physicians identify as Black. So I've been working with HBCUs to help to create a pipeline to understand the value and importance of training and developing our future healthcare professionals, because it does make a difference. As Dr. Wynn was saying, as she's able to do that in the community, being able to identify as a woman of color with my patients when they come in, I'm able to talk to them in a way that they understand. I'm able to relate. I'm able to get information. And I'm able to sometimes mother and sister them in a way that causes them to make the best choices that will improve their outcome. So definitely my commitment, it will ongoing and forever be to diversify our profession. And I do that by teaching at both Penn and Jefferson, by working with other undergrad HBCU institutions to create pipelines to develop Black providers.
Thank you so much, Michele. Dr. Taylor, can you answer the same question? What commitments or next steps do you envision to contribute to the goal of achieving equitable maternal health outcomes for Black women?
Yes, continuing the work that we've been doing in the county with our health department, with our human services, to expand access. As we're in this area in which we are losing providers all over the county, it's really important for us as an organization, as a community, to come together to make sure we are combating that with bringing more providers into our space and into our community and encouraging that. This is a crisis in Delaware County, right? Black women and Black and brown women are 3 times more likely to die during childbirth compared to white women. And research shows that Black women are at a significantly higher risk for severe maternal morbidity, and also have high rates of admission to intensive care units, right? And we all know these statistics, and they aren't different in Delaware County. And so how do we combat that in the existing realm of losing those providers? And so it's really about being that collaborator and being that chief strategist, bringing those nonprofits to the table, bringing those mothers to the table who have experienced our system and have had a bad experience and challenging experience throughout the entire process. And it's continuing to bring all of those folks to the table, because you'd be surprised how many times we brought folks and players in this space to the table, and that is the first time that they've met. And it's like, this should not be so. And that is our role, because the more folks you have talking about it, the more ways we're going to come up to combat the issues that we have in Delaware County and across this region and across the country, because this isn't unique to us, unfortunately.
Thank you so much, Dr. Taylor. Caron, your thoughts?
My commitment is to education, educating the community, educating healthcare, educating anybody who will listen as to what a doula can provide and what an asset a doula can be in every birthing space that there is. I think when there is a lack of education, that brings fear. So when we educate, we can disseminate some of that fear and we can get together all on the same page. So I'm committed to educating whoever is wanting to listen and whoever is open. So health systems, communities, churches, and letting people out there in the communities know that this is a space where everybody is welcome. You don't have to have a medical degree to be a doula. You just have to care about people. And we can give you everything else that you need. So education and training and just making everybody aware that doulas are available, training is available, and getting them into the right spaces that they need to be in to help.
Thank you so much. Dr. Wynn? Same question. You're on mute, though.
Okay. Michele actually took my commitment, but I have another one because I am very passionate also about finding pathways to diversify our healthcare system. It's so interesting that you said that. I had a call today with the school district of Philadelphia, talking to their chief medical officer, trying to figure out ways how I can be involved with just talking to students, because I do think that it starts early, like as early as elementary school, and trying to see if there are any spaces where I can be in the faces of these children to just even pique an interest into healthcare, and if so, showing them different pathways into healthcare, because it's different for everyone and we have several barriers and different levels of healthcare, but showing them how to navigate those barriers so that they can get to their expected goal. So that's definitely one of definitely with you, Michele. Maybe you and I can work on some projects together, because that's good work. I mean, when you consider that nurses as of 2023, we're only 6% of the workforce, and that's not a lot of people. And then nurse practitioners, and Michele, might be different for you, for the midwives, but for NPs right now, since 2023, we're 4.7% of the workforce, so less than 5%. We need to start diversifying the workforce to help get rid of some of these healthcare disparities in our entire country. It's the only way it's going to change, because it's not the only thing, but it's a major thing that can really have an impact on some health outcomes. Also, I want to get behind, and I don't know how to start. I'm gonna find out though, but I do want to start getting into some advocacy work with some of the policies that are just sitting out there. The Momnibus being one, expanded the postpartum to 12 months. Last I checked, 46 of the states have expanded postpartum coverage to 12 months, but we need all of our states to be expanded to 12 months postpartum. Full practice authority for nurse practitioners is essential. It helps to kind of fill some gaps in some maternity deserts, and there's tons of them, especially in spaces where the maternal mortality rate is really high in the southern states. And then the Medicaid reimbursement for doula services is very important, because doulas are essential to our workforce, and you should be paid for the care that you give. So
Right on to everything you said, Renee. I think, from an advocacy standpoint, you should partner with Michele, because I was saying, like, prior to this, that she gave her and Alexia gave dynamite testimony to. I mean, they opened up City Hall right last week. So I thank you all for your work that you're doing in the space. From my perspective at the seat that I sit in at Independence Blue Cross, I am looking forward to working with every single one of you to help tackle this, because we are very, very committed to ensuring, at least committed to decreasing the disparities. Almost, my goal really is to eliminate the disparities and to achieve health justice, not just health equity, right? Health equity just means closing the gaps. The work that I am intending to do is to ensure that no other Black mother has to go through these concerns, these challenges going forward, right? I have 2 daughters, and I am hoping that, fingers crossed, that this is a non-issue by the time they decide to have children. Thank you guys so much. I look forward to working with you in the future, and I appreciate your participation on this panel.
Thank you for having us.
Yes, thank you so much.
Thank you.
Thank you.